We're joined by Dr. Jeffrey Potoff from UW Health to learn a little bit more about this. And Dr. Potoff, first question here, how does this COVID pill work if it gets approved?
Well, this COVID pill almost plays virus espionage. What it does is viruses like to replicate, and to do that, they have a secret code. What this pill does is it inserts extra characters, which scrambles the message, and the virus can't replicate.
How far are we from getting that FDA approval?
We're a little ways away. So, with any of these therapeutics, the manufacturer will say, hey, we've got this study, we've got good data. And usually they're right. But, we have checks and balances on any of these kind of therapeutics where folks who have no financial interest in the company, no reason at all to want to adopt this, look at the same data and say, yeah, this looks compelling versus, hey, did you think about that? Did you think about this? So we will see a lot more scrutiny of this study and supporting data before anyone would take this medicine. We want to make sure it's safe and effective.
Absolutely. And I did want to ask about this UW Health COVID-19 employee vaccine mandate numbers. I know you all were working on them. Are those out as of this morning?
They are. So as you can recall, our mandate was October 1st to have that series started. And, for reference, UW Health had 16,185 employees within that mandate. And as of today, we have 99.96% of employees compliant with that mandate. So the vast majority of our employees, after we discussed this with them, chose to get vaccinated. A few have waivers, but that's where we are sitting right now.
All right, we were looking forward to those numbers as well. And I also wanted to ask you about the importance of the flu shot, because I'm hearing some conversations going on in the community where if you get the COVID-19 shot, you don't need to get the flu shot. Where do we stand on that?
Yeah, so I have heard this too, but no, we need to get both this year. So, some folks may think that the flu may not come around this year because it really didn't come around last year, but there's pretty good reason to believe that we will have a good flu season this year, more cases, and a flu shot is a really important thing to get. It prevents you from getting the flu, prevents folks from filling up hospitals with influenza, but you can get a COVID and a flu shot together. So if you haven't got either of them, sign up for both of them, go get that done. Two birds, one stone.
And in terms of talk around town, if you would like to call it that, the University of Minnesota just released a new study here, and the result of their new study regarding people who've had COVID-19 and them thinking that they don't need to get the vaccine. So the study here shows that yeah, people that have COVID-19 think that they don't have to get the vaccine per se. So, that's just something that I wanted to talk about because, again, I think it's on the mind of a lot of people as well.
I can see how people would be confused by this because what we know is that folks who get COVID-19, they do generate immunity. That's true. There's been some misinformation out there with regards to how good that immunity is, how long or how durable that immunity is. And what the science is although you do get some immunity, it's somewhat short-lived. And if you're a person who's had COVID-19 and then goes on to get vaccinated, your immunity is outstanding. And that's why you continue to see all these scientific bodies continue to recommend that if you've had COVID-19, once your symptoms resolve, go ahead and get immunized. That's the best thing you can do.
So having COVID-19, Dr. Jeffrey Potoff, is just not sufficient to fight the virus.
Yeah. Right. It gives you some protection. It's unlikely you'd get reinfected right away, but it won't last that long. And if you were initially infected with, say, non-Delta COVID-19, Delta variant is much better at making you sick if your immunity is only based on non-Delta COVID-19 infections.